My favorite
Yeah,
team. GOT. So tell us all about it.
Absolutely. So the challenge we're confronting is how to connect unaccompanied minors making the transit through Turkey better connected to medical services that they might need. And we identified unaccompanied minors as one of the most vulnerable groups making the dangerous journey through Turkey, often onward to Greece and throughout Europe. So we had the challenge of using data in a health context. So what we came up with was a database that would be used by UNHCR, the government of Turkey, and healthcare providers to better match unaccompanied minors as they made their transit through Turkey or remained in Turkey with the appropriate healthcare provider that was also located at the right area. So after the first interview with UNHCR, where their protection needs are identified and personal information is shared with the agency, the specific protection concerns relating to health are also identified by the UNHCR officer. This information goes to a database and is also shared through this database with the government of Turkey, who is populating the database as well with the locations of healthcare providers. The UNHCR can use this information as well as the information given to them by the refugee on where they would like to go in Turkey, where they intend to go, to match them and provide a recommendation on a camp, a city, or an area that might give them the most appropriate services. So this decision, of course, it's a recommendation. They can't enforce necessarily where this unaccompanied minor will go, but they can try to do their best to provide this service in partnership with the government of Turkey. So upon arriving at their camp or wherever they might be ending up, UNHCR and government of Turkey will work to connect them with the healthcare provider and ensure that the service continues. And the provider themselves will update this database to let them know that they've been connected and that the child is receiving the care that they need.
Now, with every design or plan, we need to look at the limitations and concerns associated with that plan. So our first concern was the frequency of updates. How often will the database be updated and managed, and by whom? So we decided that, or figured out that the database will be updated once a week. And all the data, again, will be, because the database is centralized, all the information that has been updated will also be updated at the central location. The next and most important aspect that we need to worry about is access and the permissions and the privacy of this data. Who has access to the data? Who can see what kind of data there is? And who is the governing body of this data? So we decided that each healthcare provider will have their own little server or part of the database set up in their own camp, so as to know what kind of medical issues that each refugee child has and their medical history. And again, all this data will be encrypted and will only be accessed by authorized personnel. Now we also have to look at the idea of this database being either centralized or decentralized. And our team actually spent quite a while trying to understand whether which is better and what is more efficient. We ended up going with the centralized idea because A, it's more cost efficient, B, it's easier to set up, and C, it's also easy to govern. And then finally,
Last sentence.
okay, and and finally, we have to also think about the concern of whether all the refugees affected will be in agreement to this idea.